Hello and welcome to this video on gastric carcinoma, also known as stomach cancer. In this video, we will discuss what gastric carcinoma is, its causes, symptoms, diagnosis, and treatment options. Gastric carcinoma is a type of cancer that begins in the cells lining the stomach. It's the fifth most common cancer worldwide and the third leading cause of cancer deaths. There are several types of gastric carcinoma, but the most common type is adenocarcinoma, which accounts for more than 90% of cases. The exact cause of gastric carcinoma is unknown, but several factors may increase the risk of developing it. These factors include Helicobacter pylori infection. This bacterium is found in the stomach lining and causes chronic inflammation, which can lead to cancer. Family history. Having a first-degree relative with gastric carcinoma increases the risk of developing it. Age. The risk of gastric carcinoma increases with age, especially after age 50. Smoking. Smoking increases the risk of developing gastric carcinoma. Diet. A diet high in smoked, pickled, or salted foods may increase the risk of developing gastric carcinoma. The symptoms of gastric carcinoma may not appear in the early stages of the disease. However, as cancer grows, the following symptoms may appear: weight loss, abdominal pain, nausea and vomiting, feeling full after eating a small amount of food, which is called early satiety, dysphagia, melena. If a patient is having suspicious symptoms of gastric carcinoma, further evaluation should be done with upper GI endoscopy. The typical appearance of gastric cancer on upper GI endoscopy is a friable ulcerated mass. In patients with a gastric ulcer, the presence of folds surrounding the ulcer crater that are nodular, clubbed, fused, or stop short of the ulcer margin, and the presence of overhanging, irregular, or thickened ulcer margins are also suggestive of a malignant cancer. However, gastric mucosa may appear normal in patients with linitis plastica, a particularly aggressive form of diffuse type gastric cancer. During endoscopy, any suspicious appearing gastric ulceration should be biopsied. A single biopsy has a 70% sensitivity for diagnosing an existing gastric cancer, while performing 7 biopsies from the ulcer margin and base increases the sensitivity to greater than 98%. Poor distensibility of the stomach may be the only finding on endoscopic evaluation for tumors that have extensively infiltrated the mucosa and muscularis propria. Imaging tests such as CT scan, MRI, or PET scan may be used to get a better look at the stomach and the surrounding tissues, aiming for the staging of cancer. Treatment modality for gastric cancer depends on accurate preoperative staging. For patients with potentially resectable tumors, surgical resection is the principal therapy as it offers the only potential for cure. The most common procedures are total, subtotal, or distal gastrectomy. The choice of procedure and the extent of nodal dissection are determined by the ability to obtain clear microscopic margins. The recommendation is to give neoadjuvant chemotherapy over initial surgery followed by adjuvant therapy. However, upfront surgery followed by adjuvant therapy remains an accepted approach for some cancers. The optimal approach for patients with locally advanced, unresectable but non-metastatic disease is uncertain. A reasonable approach for a fit patient with a good performance state is an initial attempt at downstaging with chemotherapy, chemoradiotherapy, or a combination, followed by careful restaging and surgical exploration in responders who have no evidence of metastatic disease. For locally advanced unresectable tumors or metastatic disease, Palliative care should be initiated. In the palliative setting, radiotherapy provides relief from bleeding, obstruction, and pain in 50 to 75% of patients, and median duration of palliation is 4 to 18 months. Palliative therapy targets to improve the quality of life of the patient and improve nutrition. In summary, gastric carcinoma is a type of cancer that begins in the cells lining the stomach and is the fifth most common cancer worldwide. The exact cause of gastric carcinoma is unknown, but several factors may increase the risk of developing it. The symptoms may not appear in the early stages, but as cancer grows, patient may experience weight loss, abdominal pain, nausea, and vomiting. Further evaluation should be done with upper GI endoscopy if suspicious symptoms are present. Treatment options depend on accurate preoperative staging, but surgical resection is the principal therapy for potentially resectable tumors. For locally advanced unresectable tumors or metastatic disease, palliative care should be initiated to improve the quality of life of the patient.